Welcome back. It's the third hour for Breakfast Extra. Let's do another big report, shall we? Today we turn our attention to Adamawa State, where fear has gripped residents of Malabu community following an outbreak of a suspected Buruli ulcer. Health officials confirm at least 8 deaths and dozens more affected. The disease, which causes severe skin ulcers and deformities if untreated, has sparked panic and raised urgent questions about Nigeria's readiness to handle outbreaks in vulnerable rural areas. Authorities have deployed medical teams and intensified surveillance, but limited healthcare access, late reporting, and the stigma around the illness have worsened the crisis. Families in Malabu are living with uncertainty, unsure whether they or their children may be next. So to give us more details from the ground, we have new Central Correspondent Aishat Salihu, who actually put in this report through the week.
Malabu community lies between Nigeria's northeastern state of Adamawa and Cameroon, about 17 kilometers to 20 kilometers away from the state capital, Yola. The community is now gripped by a rare and dangerous outbreak of a strange and mysterious disease. Locals have called it many names, but what they are battling with is a flesh-eating disease whose cause remains unknown.
Zuwa ya dan dade amma bai yawa ba sosai kaman wannan karo don shekarun baya shekaru biyu ko uku da suka wuce bai wuce mutane 5 ko 6 bane suke da dauke da wannan abun wannan ciwon gafa amma yanzu ya zama to akwai mutane kusan 30 zuwa sama.
They assume that it is not a case of the facility, because when they came to facility they are going to inject them, so this is why they are fearing of, so they are not coming.
What we'll be doing now is to make sure that those that are affected in the community, let them come to the nearest facility in the Malabu and receive the dressing and also some antibiotics to aid healing.
For Ahmadu, a 50-year-old farmer, it began with his son and later his brother. Both died within weeks of contracting the disease, now equally suffering devastation from the disease.
Na yi wata uku can da muka dawo gida wannan dotta Aminu yana zuwa yana wankewa gida yanzu wannan wata na 10 kenan wannan ba na gani zai kamar zai kara tun da dai ana da yawa kuma ba wannan cutan kawai ne sanadi ba.
At least 67 cases have been confirmed by health authorities. Most of the affected live in remote parts of Malabu and are too afraid, too ignorant, or too poor to seek hospital care. Only 8 patients have agreed to be admitted at the Malibu Adamawa University Teaching Hospital in Yola.
When results from the National Reference Lab is out, the causative organism can be identified and proper treatment, which has to do with the causative organism, can be prescribed by medical officers.
So our main aim now is to checkmate the spread of the disease, and that's why, since the result is not out, we advise them to come to the health facility.
Health officials warn residents not to rely on traditional medicine, which may worsen the infection. But fear runs deep. Many believe the disease is a cause affecting their lives.
Shine farkon abu shi kurjin haka nan kawai ya fita wani kan ban iya tantancewa ga inda na same shi sai dai kawai bullar shi a jikina.
Gaskiya ni tsoron da ya bani ɗaya ne dan har ga Allah da kan bai yawanta kamar haka ba, amma yanzu ya yawaita kuma yanzu gaskiya ƙara karuwa ke dan yanzu bayan kama yana wani ma akwai wasu ma da dama wanda ya dan ƙara kama sabon kamu dan yanzu yaduwa yake yi ne shi yasa ba magana raguwa sai karuwa.
The Adamawa State Ministry of Health confirmed that samples have been sent to Nigeria Center for Disease Control in Abuja for histological analysis. Results are expected within days.
The health officers are on top of this. Like we keep on saying, there are emerging new phases of epidemics now, not only in Adamawa State, the world over.
Until results come in, the people of Malabu wait, some in pain, some in fear, and others in silence. For now, what they face is not just a disease of the body, but a crisis of access, information, and trust. But for the residents, the biggest question is not scientific. It's simple. Will they survive? In Yola, for News Central, Aishat Salihu.
That was a brave report from Aishat, and this is clearly a crisis that goes beyond Adamawa. It touches on Nigeria's public health preparedness, community awareness, and the trust citizens place in the system meant to protect them. To unpack this further, we are joined by our very own Aishat Salihu. Aishat, good morning.
Morning, Queen.
Aishat, from your experience having been to Adamawa, what makes this outbreak, this ulcer, so devastating in this community?
Queen, I like your just word. You mentioned devastating. It is indeed devastating. And I would say the report didn't even capture all of what I saw in that particular community. I mean, we have children who also have come down with this disease. And I would say that there is fear of transmission of this disease because some persons within the community mentioned that it first started with their brother and later on to their son and then to them. And then again, another thing I'd like for us to even point out here is that not just transmission within the community, perhaps it could even have gone to other parts of the north because this patient who spoke with me mentioned that his brother, who eventually died, was admitted in BU, and BU is not in Adamawa, so that should also be put into consideration. But first of all, the first thing that matters here is it just bothers on our level of surveillance for diseases, whether infectious or not. It just means that because this is not the first time we're seeing disease outbreak in Adamawa State, and so what does it say? As much as this is new, although the community people said that some persons have been dealing with this for over a year now. Since last year, even you heard the community head saying that this is not something that is new in their community. They've had patients since last year, but I guess it's just been pronounced as an outbreak just this September. So it borders on disease surveillance and also information because most of those people, they don't know what is happening. They had initially called it a local Hausa name, a terminology saying that the disease is something that where you shouldn't inject yourself. Once you do that, it kind of complicates it. So it makes them to go further to use the traditional means of treatment. But then noticing that the skin, the skin on the flesh on the skin is still tearing and then it's eating down into the bone. So it's becoming really terrible. So it's more like there's now sensitization within the community, just like the state health officials mentioned, that there's now sensitization within the community through traditional and religious institutions to call on these people to visit the healthcare facilities. But then that particular community, I saw just one primary healthcare center. And from what I learned, most of the people who have this disease are within inside the community. So there is now the issue of having to come down to the healthcare facility, and then the state health officials mentioned that what they are doing now is they're just treating wounds and then using antibiotics, treating wounds and the flesh wounds on the skin and all that. So how does this even address the matter? Because there are fatalities arising from this disease already. Only 8 patients were admitted at Malibu Adamawa University Teaching Hospital. Those were the ones who agreed. And from what sources within the hospital, even though officials of the hospital refused to speak with us, but from what some sources are saying that out of those 8 that were admitted, there are still complications. Some are comatose. There are 2 persons, as of yesterday, I learned 2 persons have also died. So these are so many issues to unpack, and then we're still waiting for the test result from the laboratory at the Nigeria Center for Disease Control in Abuja. And mind you, this is the second sample that they have gone back to take. As the first sample they took, I think maybe due to temperature of the area or on their way to transport it to Abuja, it got bad. So they had to come back here to take another one. And this further speaks to the issue of facility, the fact that there is no available facility within that state. Nigeria needs to do better. Queen.
Aisha, that's a very interesting story you've just told there. First off, I'm very interested to know what the locals called the disease at first. You said they used the local term to explain what it was, telling don't inject yourself or it might get worse. But what did they call it in local terminology?
I I can't really remember now,
Okay.
but then it was a Hausa, it's something that in Chihuahua or something, it's a Hausa terminology.
Okay.
From what they are saying is that they think it's a disease that you shouldn't use injections, just go on and treat it locally. But and another thing I'd like to even point out here is that the fact that the state health officials, there is some sort of, they're hiding information. As a matter of fact, we tried to reach out to the commissioner at the time. He mentioned that he's not available. And then we met with the director of public health, the acting director of public health, and he was even the one that is granted interview, because on that particular day when we went to the community, they were delivering some health commodities to help with treating the wounds arising from there. And now even people at the Ministry of Health, there's little information. The only thing they're saying is they're just trying to remove or sensitize people from whatever conception or misconception they have about the disease. Even also the officials at the Malibu Adamawa University Teaching Hospital, when we approached them for interview to know what the situation of the patients that they have in their facilities is, they mentioned that the patients they have are state-owned patients. Please, emphasis on state-owned patients, and they can't give us information about them except we get authority or hear from the state itself, the Ministry of Health in the state, that's the executive, maybe the executive secretary of the Primary Healthcare Development Agency in the state. But although those patients have been reserved at the isolation center, and then they're talking about if the disease may be infectious, so there's the isolation of patients. Now, my point now is, so how do we then look at prevention? If by now we don't even know the cause of this disease, then what about prevention for people who are still within the community because there is fear of the disease spreading already? What about prevention, then treatment? Is the treatment really working? Whatever they're giving to these patients, is it really working? And then how come we're still having fatalities from this case? So,
Aisha, thank you for giving us the external factors regarding this disease and also the biological nature of it and how we still don't know exactly what it is or how the locals feared it. But I want to take this to a much more internal point of view. On your side, when you got the call to come investigate this issue in Adamawa State, you had to first of all get in a car, go there and then interview people who told you about how bad this disease is, how they've lost brothers, family. And I'm wondering, how did you deal with that? Also noting that there's a risk of infection.
Okay, so upon going to the community, we realized that at first we didn't even know that there may be a risk of maybe the disease spread and transmission, because we just went, and then until we got there, that was when we started hearing stories from those people. And I also want you to know the fact that this community is an agrarian community. Most of the people there are farmers. They indulge in crop and animal production. So most of the people we even spoke with, a young boy who in that video, he mentioned that he was on his farm one day and he just noticed this thing, and then since then it's just been a boil popping out from his leg and then spreading, eating the flesh and then spreading. So now, and then we also noticed that particular community, there is poor infrastructure. When I say infrastructure, there is no potable water drinking source. I think we saw about a few rivers. It's just one river where you see children bathing in that river. They defecate in that particular river, and also they fetch that water to take it back home for cooking, for any other thing, domestic use. So it just boils on, we need to find the causative organism, responsible for this. Is it from the water source? Is it from the farmland? Is it from, so there's just a lot of information that is not really available, a lot to unpack. And again, that is what is even driving the lack of trust, because some of the people there, even when we're coming back out of the community, the residents, I told you, it's a border community between Nigeria and Cameroon. So most of the security people we met on the road, they were even asking, what is happening? Do we need to run? What is going on? There's just a lot. So there has to be more information available, and then the health officials within the state has to do more about telling the people, this is the cause, this is how you prevent, this is how you treat, please come to the hospital. And then we should also put it into context that this Buruli Ulcer, suspected Buruli Ulcer, is one of the neglected tropical diseases, and then it's ravaging Adamawa State at the moment.
Aishat, let me just take you back a little bit. You mentioned that most of the people that you spoke to were farmers. And we can also see that they're talking about this ulcer can be caused by, stagnant water. So it comes, now I'm thinking, if you said you spoke to most of the farmers, are their farms flooded? So are they farming while their legs are in this stagnant water? Do you think that this might be the cause? And you also mentioned the young boy who said he was at the farm and next thing, he felt a sting, and then next thing, this whole disease. So do you think it would be their farm, because you mentioned, talking to most farmers?
Okay, so right now, I cannot really particularly tell you what is the cause, because that is the function of the health experts, the medical officers, and even those at the laboratory at the Nigeria Center for Disease Control. But what I can say is that, like I said, there are farmers. Some indulge in grain farming, especially rice. And you know how the farmland for rice is. There is a water channel that should go into the farm, and so that alone. There's that issue of it could be from the farmland, it could be from the water underneath the soil, it could be maybe a bacteria or something, an infection from there. So that remains to be unknown. But what I'm more concerned about is the fact that the health officials, there is delay. If there are 8 fatalities, and that is even official, the official figure, because from the people we spoke with, some said they have lost 2, they have lost 1, they have lost 3, they have lost this. So it means even the 8 that the government is saying, the 8 fatalities that the government is saying has arisen from this may not even be the true figure, because like I said, there is underreporting of this case. So it just goes further to say that where is the swiftness, in action for the state health officials and also the NCDC in Abuja. The first sample they took, they said it should take them 10 days before the results will be out. And now they have gone back again to take another sample. So is it going to take another extra 10 days whilst we have the fear of people losing their lives? There's so many things here to unpack. And then how do these people even, first of all, prevent themselves? And then some of them have been dealing with this from last year. Imagine having an injury on your skin since last year. Not just an injury, an infection, I'd like to put it that way, on your skin since last year, eating deep, tearing the skin. We couldn't even put all of the images in the video because they are really gory because of viewers' discretion. So it's just a lot to unpack.
Aishat Salihu, thank you very much. It is indeed a lot to unpack, especially in a place where health care is very difficult. But we hope that they get at least something to help alleviate the pain, and at least an answer to what exactly this disease is. To you, I say thank you very much for such brave reporting, because I don't know if I would have went, even if Mr. K called me. Sir, sorry, I'm not going.
As you know.
But thank you. Thank you very much, Aisha.
Thank you, Aisha.
You're welcome. Thank you.